Second take. Okay. Hi, we're here with Dr. Preston Maring of Kaiser Permanente at his Food4Health forum. Dr. Maring has been organizing this for 2 years now, and you're connecting medical practitioners with industry people to try and have this conversation about how food is related to health. So, Dr. Maring, tell us about how you started this program.
Well, I've been at Kaiser Permanente for 40 years as a primary care physician in women's health, and it's clear to me that what people eat is a prime determinant for their long-term health, for their future. 8 years ago at my hospital in Oakland, I started the first hospital-based farmers market. Kaiser Permanente now has 40 markets around the country. There are hospitals all over the country that have farmers markets, and that begins to make the obvious connection between good food and good health. But there's so much more work to do. We still have only less than 5% of some of the young men in some of our populations eat 5 servings of fruits and vegetables a day. We've got so much work to do as healthcare providers and others affiliated with healthcare to encourage the broader population of people to eat fresh foods, whole foods, learn to cook themselves, learn to prepare them at home. Those simple steps can change the future.
And Eric Schlosser was just speaking. He's a writer of Fast Food Nation, and he was talking about how $1 of preventative spending would save you $5 down the line. So with your program, have you discovered any metrics around your prevention programs and how it has helped Kaiser employees or members in maintaining better health and saving money?
We can't measure that yet, because even if somebody comes and shops at a farmer's market, we don't have any way really of knowing what they're eating in the rest of their life. But what we do know is that people who do come and shop at a farmer's market, we did a survey of about 2,500 people. Something like 76% of the people that shop at farmers markets at our hospitals say that they're now eating more fruits and vegetables than they used to, and fully 71% saying they're eating new and different kinds of fruits and vegetables. So I can't measure yet people's overall long-term health, but what I can say is putting a fresh peach in front of somebody in the middle of summer makes a difference. Showing someone a bunch of fresh asparagus, that makes a difference. That can encourage people to do more than what they've done before.
One of the messages at your forum is how food is connected with sustainability, and how if we eat better, we actually do better by the environment as well.
Exactly, particularly if you eat foods that are grown closer to home, foods that are grown without pesticides or chemical fertilizers. Those are foods that are the best for us, the best for our kids, but they're also good for the environment, and they're also much better for the farm workers that grow them.
Awesome. So what's next?
Oh, what's next is a program that we're putting together to connect local farmers to major institutional purchasers with the belief that if our small and mid-sized family farmers can see a defined marketplace for 1 million or 2 million pounds of their product,
Right.
that they will be able to grow the fruits and vegetables to suit, and it will be better for them that they know they have a defined marketplace as opposed to just growing their crops and hoping they can sell them somewhere. So that's the next big project. We hope that by supporting the small and mid-sized family farmers, that we end up eventually with just more and more good food coming into the system, available to more and more people.
Amazing. Thank you so much for the work that you're doing and for spending time with us.
Thanks for the opportunity to talk to you. Take care.
Take care.